Welcome to Richard and Greg, a channel dedicated to discussion, debate and argument on a whole array of topics. Today's coronavirus update provides the latest figures both globally and nationally and pursues an idea of how to prevent overcrowding in hospitals when the virus takes hold of a country. I, and controversially Greg, discuss this potential idea and would very much welcome your thoughts. Welcome to Richard and Greg. It's Tuesday, the 17th of March, 2020, and the time is 18:46 GMT. And as promised, we are undertaking our regular every other day update on the situation regarding coronavirus. And I've just noticed myself that compared with yesterday, in the United States, at least 1,000 extra cases have been recorded. But let's get the coronavirus expert himself on the line. Greg, good evening.
Good evening. And it may be a good evening on the personal basis, but not on the global basis, or a good evening for mankind. I predicted yesterday that today would be the day when 200,000 people would have been recorded with coronavirus. Well, so far today, and we've got several hours to go, 196,461 cases are on record worldwide. I also predicted that we top 8,000 deaths today. And in fact, at the moment, we're on 7,924 deaths. So I think we're going to be fairly certain of going over 200 cases reported and over 8,000 deaths reported. But do be minded that with 200,000 coronavirus cases reported, there will be many cases that are not reported, either because they are completely asymptomatic or because the symptoms are so minor that it never got reported. Just as many deaths will appear to be from other pneumonia type illnesses that are allied to geriatric pneumonia, post-operative pneumonia, or just the joys of pneumonia, because let us not forget that pneumonia always used to be called the old man's friend, because if you were dying or in the final stages of one's life, pneumonia was usually what finally killed you, and it spared you further indignity, further pain, and further suffering. So it was called the old man's friend.
So let's get on to the figures, Greg, because this is going to be a short podcast this evening.
And to continue with the figures, Richard gave us 1,000 new cases in America. It's actually recorded as 1,060, but we do know that huge numbers are not being recorded because there are insufficient test kits to be able to directly establish them. So America currently is reporting 5,723 cases and 97 deaths. The UK is reporting 1,950 cases and 71 deaths. Neither case is good news, however you might look at it. Italy is still, shall we say, the star performer after China, with 31,500 recorded cases and 2,500 deaths, which is way up on Iran, that is next on the list, with 16,000 recorded cases and 988 deaths. Spain is fast catching up with 11,400 recorded cases, up by 1,467 today alone, and their death rate is up by 168 today alone, and is now 510 deaths. I can go on and bore everybody rigid with figures, but if you're particularly interested in the figures, you will probably be reading from a similar listing of figures to that which I am reading.
Greg, do you think there's anything to read here, looking at the Italy figures and the Spanish figures and the levels of death to cases? In Italy, the death rate is now very close to 8%, but in Spain, it's 4.5%. Can one read anything into that?
I think the biggest thing one reads into that is the accuracy of the figures.
Okay.
Rather than a specific statistic difference. For instance, we have a very low number of cases in America, but then again, with 350 to 370 million Americans, it has been admitted they only have 1.3 million test kits. So obviously, they aren't going to have tested as many people. So these are only guideline figures, but none of them are good, especially when you think that this pandemic has now spread to 163 countries.
I understand you have a special message to convey today, Greg.
Well, I've been thinking about what is going to happen if we have the bad news situation that it looks all too likely we have. Now, I'm going to base this on Britain, but quite honestly, I think it would apply to any country worldwide that believes in some sort of healthcare system to look after its people, whether that is a private one or a public one. There is no way that a health service system can be prepared for a pandemic. It would have meant in Britain, for instance, that we had had all of the equipment, empty beds, ventilators, and the like, and we would have had them sitting there idle since 1919, which was the end of the last global pandemic, namely the Spanish flu of 1918, 1919. And you can bet your life that if we'd had the equipment sitting there for over 100 years waiting for the next one, two things would have happened. One, the equipment would be obsolete, neglected, and buried in spiders' webs and cobwebs because nobody had been paying attention for 100 years. And two, you can bet your life it wouldn't have been a respiratory pandemic. It would have been something completely different, like salmonella or cholera or yellow fever or smallpox or some similar pandemic, completely different to the one you were fully equipped for. So you would have to probably carry 10 different complete systems and be prepared to sit there for 100 or 200 years waiting for the right pandemic. So it was never going to happen. So we prepare for what we think we might need as a first off. And in Britain, we thought that we might need as a first off some 5,000 ventilators and oxygen supply to virtually every bed in the hospital. Now we find that with the numbers involved, there is the reality that our hospitals are treating the sick, the lame, and the halt, ignoring those with COVID-19. They are working very sensibly near their capacity. You don't want vast acres of empty hospital and staff sitting around twiddling their thumbs, waiting for a pandemic that maybe comes along every 100 or 200 years. We are dealing with this by, in my opinion, some very good judgment from the present government, which is to keep kicking the tin down the road for as long as we can to damp out the beginning of the escalation in a big way, so that we can prepare more beds, we can prepare more policies, we can implement more legislation to be able to cope with a near exponential growth of the disease when it occurs. If we stop the disease totally, which could be done by keeping everybody in total isolation, it would be difficult, it would be draconian, it would be possible. All that does, if you kept everyone in total isolation where they could not catch it, and God knows how you do that, and you did that for 3 months, all that would happen is that in 3 months' time, when that was removed, no one would have developed any kind of immunity, and it would start to escalate alarmingly at that point. So let us see if we can manage the growth at the beginning end, which is what they're doing. Now, I believe that the health service in any country in the world will be inadequate to cope with a major pandemic that we are currently seeing the beginning of. So what could be the solution? I'll give you what I think could and should be done by Boris Johnson with his present team. Keep playing it down until you have no choice but to introduce emergency measures legally. At which stage you would have been able to put a few people in place ready to implement those emergency measures. First of which would be to commission the health and safety officers who are trained for this sort of emergency, not fully trained, not hugely trained, but adequately to provide the backbone of a system that could cope with it. It would be their job to requisition every leisure centre and every school, assembly hall and gymnasium in the country, to recruit the staff from amongst the council staff initially, and by liberating some 18,000 trainee nurses who are in their final year at university at the moment to qualify as nurses, to liberate them with a nursing qualification to working together with those council officers to set up teams for every leisure centre and every school hall, turn every leisure centre and every school hall into a Nightingale ward style setup. The Nightingale wards were the wards that pertained for many, many years, named after Florence Nightingale, and they were large wards with 40 or 50 beds in them, a table down the middle, so that the healthier patients could be got out of bed during the day, eat their meals at a table, and be progressed to cure with a centralized nursing station that could oversee the whole ward and see where any kind of a panic was developing. And we could issue the health and safety officers with, let us say, a range of different colored vests for personnel, let's say blue, red, green, purple, and yellow, 5 of them. New patients coming in could be addressed by the ones who were trained to take in new patients, and they would wear purple vests. If those patients had up to a certain level of temperature, they would be trained as to what to do with them.
Now, let me stop you there. The one thing everybody is saying is do not congregate people together. And you're suggesting people who may not have the virus are put into an environment with people who actually have the virus. That doesn't make any sense.
They are believed to have had the virus when they come in.
Right.
to this facility.
So what difference does the temperature make? If they've got the virus, they're already high temperature anyway. So what does a
They're
few
not.
degrees?
No, they're not. Many people have the virus and they're totally asymptomatic
So
and
how do,
don't have a temperature at all.
so what difference does it make if they've got a temperature if they haven't?
They are easier to manage. Therefore, the people in, what was it, the purple vests, as they come in, would be able to manage them because they don't have symptoms that need controlling. So they would be trained, which would probably take a day's training just to look after them, to remain in bed rest until they either get worse or they get better.
Let me
To
tell you
go,
why I don't think that will work. A friend of mine has a baby who is ill. He's telephoned the doctor, and the doctor has refused to come out. They've contacted the health worker, and the health worker rang him and said, "We're very sorry, you can't bring the baby in, and we're not allowed to go out to people's homes." So how the heck are you going to get them into these centers? I don't understand.
this is exactly what I'm telling you. When they reach a certain temperature, you are handing them on to the next level of training. Not better trained, but differently trained. So you have 5 levels. You can have an admission level that deals with people, and we do have that in Britain with our service where you phone up and you are given telephone advice. Now, with youngsters, it is probable that this disease will do them very little harm. Therefore, it is best to keep them at home, keep them safe, keep them warm, keep them in fluids, and look after them. But if the temperature goes up over a certain level, then you need to take the next step. These steps will be defined to fit in with the organization I'm advocating. Yes, my theory is shot full of holes, but at least it's a skeleton theory we can fill in the holes on as we go along. At the moment, there is no theory. There is no way we can treat all these people who will present. There aren't enough nurses. There aren't enough doctors, and there aren't enough beds. I've provided so far with what I've suggested: beds, trained staff, better trained staff, differently trained staff, administrative staff, and 18,000 new nurses, nursing staff. I think that's not a bad place to be starting from in this issue, when at the moment, we haven't got a bloody clue what we're going to do. We haven't enough beds, we haven't enough ventilators, we haven't enough nurses, we haven't enough hospitals, and the very last thing you want to do is send people with COVID-19 to hospitals to infect people who are already impaired, either because they've had operations, accidents, or other illnesses. Don't forget, our main hospitals are also our main maternity wards. They're also our main geriatric wards. We're sending these very sick people, potentially very sick people, in, what, to kill off everyone in the hospital? I suggest my idea may well make more sense when you look at it closely.
And before we go, Greg, you said Johnson, Prime Minister Boris Johnson, is kicking the can down the road. What do you mean by that? How can he kick the can down? I don't understand what that means.
Ideally, we do not wish to shut schools.
But we are, as from Friday.
We do not wish to shut schools until we have to shut schools. Because immediately we do, we will be sending children home to be looked after by their grandparents in many instances. So that is not a good solution. Now that we have reached the stage, mainly because they've been browbeaten and battered by populism, we find that there is an aim planned to shut schools. I don't think it's actually been announced as law yet. It has merely been a recommendation. And until that happens, we won't lose literally thousands of members from the labour force in Britain who now have to stay home to look after children. And therefore, by having not done this until now, or whenever he does, he has kicked the can down the road at least that far, giving more time to present and prepare a way of dealing with the resultant problems. The aim is to kick it down the road so that we can deal with it better, particularly once hospitals are liberated from the normal assortment of higher level winter illnesses.
Well, Greg, to be fair, I don't really disagree with what you've suggested. The only concern that I legitimately have is that our local council, for example, have already told half their staff, don't bother to come in, you can work from home. So how we're going to get these people to these sites, I really don't know. But it's a very laudable and potentially practical solution. But whether they'll actually have the foresight to do it, well, we shall report.
Only time will tell.
Only time will tell, and we shall report on that in the days to come. Greg, thank you for taking stick off me, and look forward to a bit more thrashing in 2 days' time.
Indeed, happy to deal with it because it's the best way to try and find a solution.
Absolutely.
Anyone with a better one, please let us know.
Great. And put it in the comments below. Let's do that. Thank you, Greg.
Thank you.
We hope you enjoyed that discussion, and if so, kindly subscribe to our channel and press the bell sign so that you are notified of our videos as and when they are published. And also in the description box below, we place links to certain books, articles, and programs which you may find of benefit, and for which we will receive a small commission should you purchase through our link. And this will help support our channel and to enable us to develop it further.